Hello guys, welcome back to UWorld's Live NCLEX Review. My name is Nicole here with another question drill set. If you are new here and don't know how a question drill set works, well, welcome in. I'm so glad to have you guys and get ready for your NCLEX that might be coming up very soon. A question drill set is something that we do every week, several times a week, so you can get a better practice of how to answer these NCLEX style questions. So we pull up a whole series of questions. Today's topic is fundamental, so everything like basic med-surg foundations of nursing in general. And then I give you about 30 seconds to review the question. Then we go over why the right answers are right and the wrong answers are wrong, and get a better practice of answering these NCLEX style questions. Maybe it's the key words in the question. Maybe it's the way that laboratory values or maybe the content is displayed. But get a better practice so we can master these questions, so we can ace our NCLEX. So again, fundamentals is the topic. We have Samantha in the chat moderating for me today. So if you have any questions, or I go a little bit too fast, or you need reiteration on maybe an answer choice, ask her, drop some questions or answers or whatever down in the chat. We love to talk in the chat. I have the chat pulled up here, and let's get started. Question number 1. The nurse is caring for a client who requires neutropenic precautions. Which of the following actions should the nurse take? Select all that apply. Option 1, request a prescription for the intranasal influenza vaccine for the client. Option 2, place a surgical mask on the client during transport. Option 3, remove fresh flowers from the client's room. Option 4, assign the client to a private room. Or option 5, instruct the client to bathe daily. Let me know what you guys think down in the chat. Let's get the chat going. Let's get talking. Samantha says, hi, Nurse Nicole. Hi, Samantha. Miss you here. I'm all lonely in the studio without you. Let's see those answers coming in. Good job, guys. So this is a select all that apply, so it's more than one right answer. And with select all that apply, it's definitely going to be more than one, obviously, but it's usually not going to be all of the answers. So use that how you might like. And be sure to follow us on all your favorite social media platforms, whether it's TikTok, Instagram, YouTube, Facebook. We go live on all of these platforms and post on all of these platforms, so we are easily accessible to you at your fingertips, on your computer, on your iPad. There is no way that you should not be following us on something. So follow us on your favorite social media platform. Good job, guys. I see lots of 2s, 3s, and 4s. But I don't see as many option 5s, which it also does include option 5. So correct answers 2, 3, 4, and 5. So, excuse me, with neutropenic precautions or neutropenia. What is neutropenia? Neutropenia is when we have decreased circulating white blood cells, and those white blood cells help fight infection. So if we don't have as many white blood cells, it's harder for us to fight infection, and it's easier for us to get an infection. So we want to put these clients on specific neutropenic precautions to keep them very, very safe and keep them in a clean environment. So all of our interventions here are all things that all things that create a cleaner environment for them. So option 2, place a surgical mask on the client during transport. This is when they're outside of their clean, almost sterile environment and in the outside world or in the hallway where it's not as clean and it's not, what's the word? Anyways, it's not as clean for them to walk through, so they don't get an infection. So place that mask on the client to protect themselves from getting any droplets that could be coming in their vicinity. Option 3, remove fresh flowers from the client's room. This is also true because flowers harbor bacteria, and bacteria causes infection. So remove those from the room. As much as they're pretty, they should not have them in the room. Option 4, assign the client to a private room. Again, you want as clean as an environment as possible. So with their own germs is the best possibility. So a private room does just that. And then option 5, instruct the client to bathe daily. Again, this makes their skin clean because their skin can, just touching their own skin and then maybe eating something, you can easily get an infection. So bathing daily helps reduce that risk of any infection or any germs on their body. Option 1, request a prescription for intranasal influenza vaccine for the client. This would be incorrect because that intranasal influenza vaccine is actually a live virus. And so live viruses are harder to create that immunity because it is live. So we never administer live viruses to anyone that is immunocompromised. So pregnant, neutropenic, any of those types of clients, we do not give live viruses to. So you guys did very, very good. Next question. The nurse is planning care for a client who has an indwelling urinary catheter. Which of the following interventions should the nurse include in the client's plan of care? Option 1, apply tension when securing the catheter tubing to the client's inner thigh. Option 2, maintain the urinary drainage bag above the level of the client's bladder. Option 3, empty the client's urinary drainage bag when completely full. Or option 4, cleanse the client's perineal area with soap and water. Let me know what you guys think in the chat. Love that. I like how you guys are putting those rationales that the intranasal influenza is a live vaccine. So good job. Someone says, what if they swallow dirty water while showering? Hopefully they are not consuming the water that they are bathing with. So let me know what you guys think in the chat. Also, let me know if there's any recent NCLEX passers or recent NCLEX test schedulers, or if you're waiting for your ATT to be processed, let me know that as well. I would love to give you a shout out. Wish you the best of luck or congratulations. Get those endorphins going. Let me know in the chat. And I'm seeing some good rationale. It's pretty it was pretty unanimous. I'm seeing lots of 4s, 3s, and now 2s. Bay or B is taking hers October 29th. Good luck. That's coming up very soon. Vero's taking theirs in a month. Good job. Or not good job. Good luck. Good luck to you. Lucas is waiting on their ATT. Patience is a virtue. Stella's taking theirs next month. Someone took their NCLEX today. Breathe. You got this. You got this. You're going to do just fine. Giovanni takes theirs next week. Currently in school for the BSN. Waiting for the ATT. Jen Barbie's taking theirs in November. Good luck to all of you guys. You got this. You're in the right space to get some more NCLEX resources and studying in, so you're going to do just fine. I wish the best of luck to all of you guys. Okay, correct answer for this one would be option 4, cleanse the client's perineal area with soap and water. So when we're talking about an indwelling urinary catheter, we're looking, and the question is, what should we include in the client's plan of care? So we're looking for a correct intervention or correct teaching point. So cleansing the client's perineal care with soap and water is the only option that is true, because we want to keep that site very, very clean so we don't have increased the risk for a urinary tract infection. So cleansing with soap and water is the best thing that we can do. It's basically like giving them a perineal shower or a bath in that case. So that is the correct and safe option. Options 1, 2, and 3 are incorrect and unsafe practices. So option 1, applying tension when securing that catheter tubing to the inner thigh, that is unsafe, and it could cause pain and tension and problems later on, because that urinary catheter is held in place by a balloon. So if we're applying tension, we're causing that balloon to go up against the urethra and the tract. So we don't want to expose them for any bleeding or that balloon to go through the actual tract. So let's not do that. Option 2, maintain the urinary drainage bag above the level of the client's bladder. You have to read the answer choices very, very carefully. You don't want to keep it above the level of the bladder, because then urine can flow back into the bladder. You want to keep it below. So have gravity pull everything down into the bag so it doesn't backflow and cause a urinary tract infection. And then option 3, empty the client's urinary drainage bag when the bag is completely full. This is, again, incorrect, because we want to empty it when it's at least 1/3, maybe 1/2, but never when it's completely full, because again, if it gets overfilled, then we have backflow into the tubing and back into the bladder, and we do not want that. So always best practice to empty it 1/3 to 1/2 full, not completely full. I know sometimes nursing gets busy and you leave it a little bit longer, but always, always, always try to do it way before completely full. Good job, guys. Next question. The nurse is screening clients for those at risk for developing pressure injuries. The nurse should recognize the client at highest risk for developing a pressure injury is the client who what? Option 1, frequently slides down in the bed. Option 2 is experiencing constipation. Option 3 has an indwelling urinary catheter. Or option 4, ambulates with a walker. Let me know what you guys think in the chat. Someone says they take their NCLEX tomorrow. Good luck to you guys. I'm loving when I love it when you guys put rationales with your answer choices. Gets me on the same page of how you're thinking, whether you're right or you're wrong. It helps me understand why you're thinking that way, and then maybe I can guide you back to the right answer. But so far, your rationales are good and correct. And since school is back in session, that means conference season is also back in session and coming up very soon. I'm so excited to be going to a couple of conferences actually this fall semester. So we have the first one in Florida, Orlando, Florida, Florida Nurse Association. Then we have NSNA and SNA, yes, in Columbus, Ohio, the mid-year one. Then we have CNSNA, which is in San Diego. And then we have SNAP Conference in Harrisburg, Pennsylvania. So we have lots of conferences. If you guys are going to any of those conferences, please come up to us and say hello. We love to see your faces in person and not just in the chat. And we like to be you guys' friend. So don't be shy. Come say hi. Come by our booth. Come to our lectures that we might be having on site at these conferences. Don't be a shy person. We're friendly. I promise we don't bite. Someone says, see you in San Diego. I would love to see you in San Diego, Kiki. Anyone else planning to go to any of those other conferences? Love to see it. I actually just booked my flight today, so hope to see you guys there. Okay, correct answer for this one would be option 1, frequently slides down in bed. So we're looking for the client at highest risk. Whenever it has highest risk or priority, it doesn't necessarily mean that any of these options could be completely wrong, but we're looking for the most correct answer. So these ones do get a little bit tricky, but you guys seem to get it just fine. The client that frequently slides down in bed is causing that frequent shearing of the skin, which can cause that shear type of pressure ulcer. All of the other ones, not necessarily or not direct correlation with a pressure injury, but that frequent sliding down is causing that frequent shearing. So that is a direct correlation with a pressure injury. A client experiencing constipation, this is basically the exact opposite. They're probably not going to experience a pressure ulcer because they're not having that maybe frequent moisture if they're having diarrhea or something. Same with option 3, that indwelling urinary catheter is usually hopefully keeping them dry so they don't have that excess moisture to cause that pressure ulcer. And then option 4, ambulates with the walker. This is actually a good sign. If they're getting up and moving around, that means they're relieving that pressure off of their skin and their body, so they're not going to have that pressure ulcer. So good job, guys. Next question. The nurse is talking with a client who has a colostomy. Which of the following statements by the client would require follow-up? Option 1, I should avoid drinking coffee and alcoholic beverages. Option 2, I need to chew my food completely before swallowing. Option 3, I can continue to swim in the pool every morning. And option 4, I will wait until my pouch is full before emptying it. Let me know. Someone was asking if I'm coming to Ohio. Yes, we have a good amount of us going to Ohio. I think me, Samantha, and Rebecca will be going to Ohio. Someone's asking, can we come to New Orleans? I don't know if we have New Orleans on our map, but good to know. I'll keep that in mind as I go back to my computer. Someone says, see you in Columbus. Love to see you guys. Okay, let's get back. Oh, good job, guys, with the rationale. Someone said it would explode or burst out. You are correct. Good job. We kind of went over this with one of the other questions. We were talking about urinary bags, but now we could be talking about something else. Good job. Good job. I think everyone pretty unanimous. Got it right. That option 4, I will wait until my pouch is full before emptying it. So like I said, same with the urinary drainage bag or a catheter Foley bag. You always want to empty the bag or pouch. So with this case, this is a pouch from a colostomy bag, and those ones are a lot smaller than a Foley bag. So they also fill up with gas, not just stool, but with gas. So if it gets too full, it could easily pop or burst or explode, like someone said in the comments, and we don't want that. We do not want cleanup on aisle client or patient, okay? So make sure you empty it before it gets to that point. So again, 1/3 to 1/2 full, or even just keeping an eye on it, because that gas could also be making the bag fill up rather than the actual stool. So be emptying it, or what I call burp the bag, to make sure you get all that air and gas out of the bag. Options 1, 2, and 3 are correct teaching points. Which is, I should avoid drinking coffee and alcoholic beverages. Alcohol and coffee can cause that peristalsis, so it can maybe make them have diarrhea, which may frequent changing or emptying of the bag. So yes, avoiding that would be best practice, because it kind of slows down the peristalsis of the gut. Option 2, I need to chew my food completely before swallowing. Yes, since it's not going through the entire colon, sometimes those particles don't get absorbed or broken down as much, since it's not going through the entire colon. So chewing it completely, make sure that once it does come out of the stool, it doesn't cause an obstruction of any sort. And then option 3, I can continue to swim in the pool every morning. This is true. As long as it's sealed down well and correctly, it can get wet. And you see clients shower with them, get in the pool. It is a new part of them, so you always want to make sure that they try to keep their normal life. So yes, it can get wet and it can go swimming with it. So it's okay. Good job, guys. Next question. The nurse is observing a staff member administer eye drops. Which of the following actions by a staff member would require the nurse to intervene? Cough, cough, intervene. Option 1, positions the client in the supine position before administering eye drops. Option 2, cleans the client's eyes from the outer canthus to the inner canthus before administering eye drops. Option 3, gently pulls down on the conjunctival, okay, I messed it up, sac with non-dominant hand and instills eye drop with the dominant hand. And option 4, repeats eye drop administration if the client blinks and the medication lands on the outer lid. It's been a long day, guys. I'm almost out. Today's my Friday, so sometimes these words get a little trippy for me, so don't hate me for that. Good job, guys. Also, let me know in the chat, since we are past my favorite, we're past halfway through, I can ask my favorite question. That's what I meant to say. Where are you guys tuning in from? I love to see how far you world reaches in the world, whether you're late night doom scrolling and you stumbled upon me talking nonsense with nursing, or you're in your midday afternoon and scrolling, eating lunch, or early in the morning. Let me know where you guys are tuning in from. Florida, Arizona, Atlanta, New York, Illinois, Houston, Texas, Guyana, California, New York City, Jamaica, Kentucky, Texas, Ohio, Arizona, Michigan, Qatar, Oklahoma, Florida, South Dakota, New Jersey, New Hampshire, Connecticut. This is basic. Auckland, Seattle, Bronx, California, Nebraska, Dallas, Texas. Hello, friend and neighbor. Baltimore, South Africa. It's 11 o'clock at night. I think that's what you meant. Ohio, Toronto, Somalia, Pennsylvania, Ghana, Liberia, Uganda, El Paso. Someone says hi, Nkoli. Hi, hi, hi. Nigeria, Punjab, Nova Scotia, Egypt. Some correct rationale, Newfoundland. Vancouver, Haiti, UK, lots of cool places. Yes, yes, yes. Nigeria, India, Colombia. Someone's taking their test next week. Thank you guys so much for tuning in all over the world. We have a lot of international people tuning in this afternoon. Thank you guys so much. We really appreciate it. Make sure you share, follow, like, subscribe. Send these out to all your other nursing school friends, your coworkers, your other classmates, so we can all be on the same page and pass the NCLEX on the very first time. So thank you guys for tuning in. Okay, correct answer for this one is option 2, cleans the client's eye from the outer canthus to the inner canthus before administering eye drops. So this is the incorrect action to do. We're looking for an intervene. That one word changes the whole premise of the question. So you have to read the question very, very carefully. Intervening, meaning we're looking for a wrong action. So if we clean from the outer canthus to the inner canthus, this is wrong because we could be introducing bacteria from the outer inner. You always clean from the least to the most, the inside out. Try to get everything out from the eye or out from the wound or source. So that would be the incorrect option. All the other ones, if you kind of act it out, it kind of helps visualize what you're doing and seeing if that is a correct thing to do. So positioning the client supine before administering eye drops, so basically laying the client down, this again will help because you're using gravity to just put them flat on the back to administer the eye drop, kind of like a bullseye. Option 3, gently pulls down on the sac with a non-dominant hand, so non-dominant hand, and instilling the eye drops with the dominant hand. This is correct. You always want to have the most control over whatever you're doing, whether it's a syringe, cough, cough, or whether it's an eye drop. You always want to have the dominant hand doing the actual action. And then option 4, repeats eye drop administration if the client blinks and the medication lands on the outer lid. If it lands on the outer lid, that means that the client's not getting the medication as they should. So make sure it actually goes to the source. So repeating it would be a correct answer. So good job, guys. Question number 6, the nurse is preparing to administer insulin to a client. Which of the following actions should the nurse take? So again, try to act these out. See if it feels right to you. And if not, maybe that should be a sign that something may not be right. But in this case, we're looking for an action that the nurse should take. So option 1, draw up regular insulin into the syringe first, then NPH insulin second. Option 2, hold the insulin syringe with the non-dominant hand and pinch the periumbilical skin with the dominant hand. Option 3, clean the injection site with the alcohol swab and inject the insulin before the alcohol dries. Or option 4, check for blood return before injecting the insulin. Let me know what you guys think in the chat. So far, it's pretty unanimous. Someone says clear to cloudy, but how do you know? What if you don't know which one's clear and cloudy? All we have is regular and pH. Is there another mnemonic to maybe help you remember? Good job, guys. Yeah, which one is clear? Which one is cloudy? Kind of think of your credentials that you're going for. Cough, cough. Yes, I see it in the chat. RN all day. So yes, RN, registered nurse. We're going for our RN license. So when we're drawing up insulin, you always draw up your regular insulin first, then your NPH. So this would be the correct action and the only correct action and intervention out of these 4. So draw up your regular insulin, or actually you instill air into the insulin first, then you draw up your regular, then your NPH to make sure that there's no air bubbles and you're getting the correct amount of insulin. So good job, guys. Option 2, 3, and 4 are incorrect because they're usually the opposite. So hold the insulin syringe with the non-dominant hand. So like I was saying with the previous question, you always want your dominant hand to be doing the action. So you want to hold the periumbilical skin actually with your non-dominant hand, and then go in with your dominant hand with the syringe. Hopefully you're not going like this. Do it nicely. Option 3, clean the injection site with alcohol swab and inject the insulin before the alcohol dries. No, you want the alcohol to dry before you inject them with anything, so wait before. And then option 4, check for blood return before injecting the insulin. We do not check for blood return anymore with insulin. It is a sub-Q, so no need to draw back any blood. Just go in with the insulin. But you guys did good. And so people are asking R before N, clear before cloudy. Yes, clear before cloudy, but sometimes you don't know which one is clear. You don't remember which one's clear, which one's cloudy. Remember your license because you always want your license. So regular before NPH. Okay, question number 7. The nurse is teaching parents at a community health fair about scoliosis. Which of the following information should the nurse include? Option 1, scoliosis affects only the curvature of the lumbar spine. Option 2, surgery is required to correct scoliosis. Option 3, screening for scoliosis begins in preschool. Or option 4, scoliosis can cause unequal shoulder height. Let me know which one you guys think. Also, let me know, how do you guys like to study, or what topics do you want us to cover in the next couple weeks? I feel like we're getting closer to midterms. You might want a crunch time session. So let me know which topics or how is the best way for you to study. Maybe should we start incorporating concept maps a lot more? I know a lot of people were asking about case studies. Concept maps really kind of help guide you kind of like a case study. So I think that's a good thing if you guys are doing case studies. Let me know in the in the chat. Endocrine, priority, peds, neuro, GI, ECG. We love ECG. Everyone always asks for ECG. Maternal and newborn. We have a couple of lectures of maternal and newborn coming up very soon. So check us out at uworldnursing.com to see our whole event calendar and schedule, because I'm sure we are covering those. That seems to be a very high requested topic. So we definitely always encourage that every couple of weeks. ECGs and dysrhythmias. Yeah, lots of peds and ECGs requests. We will get on that ASAP. ASAP. Okay, correct answer for this one is option 4. Scoliosis can cause unequal shoulder height. So, scoliosis, one of the most common spinal deformities. It's when there's a lateral curvature or sometimes a rotation of the spine. So, it can affect, since it is the spine and the spine goes throughout majority of the body, it can affect multiple areas of your body. So it can affect not just the curvature of your lumbar spine, so not just option 1. It can affect your shoulders, your spine, your hips. It can affect a lot of things all throughout that curvature. Option 2, surgery is required to correct scoliosis. Not necessarily, not always. If it's caught early, sometimes the client can be in a brace to kind of fix it, or do physical therapy to kind of fix and realign the spine. And then option 3, screening for scoliosis begins in preschool. This is actually pretty early. So scoliosis screening actually occurs during like the growth spurt period. So that's usually during that early adolescence time. So maybe around the preteens and the teenage time, when you're having rapid growth in a short amount of time, because the spine and the bones can't keep up. So then they kind of get a little squirrely. So this is incorrect. It usually happens a little bit later. So option 4, scoliosis can cause unequal shoulder height. Yes, this is correct, because it doesn't just affect the hips or the shoulders or the spine. It affects everything else. So you can have unequal shoulder height if it's a significant curvature. But you guys did very, very good on that one. Last question of the day. The nurse is teaching a client with orthostatic hypotension. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. Option 1, perform carotid artery massage. Option 2, decrease dietary sodium intake. Option 3, apply graduated compression stockings. Option 4, implement fluid restriction. Or option 5, administer fluorocortisone. Let me know what you guys think in the chat. Also know it's the final question. Let's have a little bit more fun before I say sayonara. Let me know what school you are going to. Rep your nursing school, rep your school in general, your alma mater. If you just graduated and you're waiting to take your NCLEX, what school are you representing? Let's see what my first school will be. Southeastern College, Long Island University, Honduras. I guess that one was my first one, but they didn't finish typing it. Valley College, 3 more months. Someone just graduated from Concord. Someone also just graduated. York in Canada, York U in Canada. Purdue University. Uwimona, West Coast University, Nebraska Methodist College, Dorsey, University of New Mexico, UCF Orlando, UTA. If that's UTA in Arlington, that's my alma mater. Cool stuff. South College Atlanta. You just graduated. Congratulations to you. Thompson Rivers University in Canada. Rochester, Centennial, Nepal, All-State Career School. UNIP from Brazil. And we got some good rationales in the answer choices. I see a good mix of 2s and 5s, 3s and 5s, 2s and 4s. This is the select all that applies. So it is more than one correct answer. And it's at least 2, but usually not all 5. So it seems like most people are just choosing 2 answers and the option number 2. Maybe, maybe not. Okay. There seems to be a good split between this one. This one is actually options 3 and 5. So with orthostatic hypertension, the main thing, well, what is orthostatic hypertension? This is when you have a significant drop in your blood pressure when you go from certain positions. So usually from lying to sitting or sitting to standing. Your vascular system can't keep up, and so you have a sudden drop in your blood pressure. So you want to do, this question is asking us, what types of things can we do to help maintain that blood pressure? And keep that blood pressure elevated. So we want to do things that would bring it up. So that would be option 3, applying those graduated compression stockings, because this reduces the pooling in the lower extremities and pooling of the blood in the lower extremities. So it kind of helps push the blood back up and keep it in the vascular system and continuously going. So that is correct and a way to keep the blood pressure up. Also, option 5, administer that cortisone, which is a mineral corticoid that mimics aldosterone. And we know aldosterone reduces sodium loss in the urine. So if we're holding on to the sodium, water follows salt. So if we're holding on to the sodium, we're holding on to our fluid, and having a higher vascular count with our blood and our vascular system, that will keep our blood pressure up. So fluticortisone is a good medication to be having. They're usually on a monitor with this one, but it is a good medication. Option 2 and 4, a lot of people were getting tripped up on this one. We would want to do the exact opposite. If we're trying to increase the blood pressure, we would actually increase the sodium intake so we can have increase of fluid in our system to hold on to the fluid and increase our vascular blood, I guess, circulation. Same thing with implement fluid restriction. We would actually want them to increase their fluid. We want them to have the fluid in their system, so we have that vascular circulation. And then option 1, perform carotid artery massage. This is actually not something that we would do for blood pressure in general. This is something that we actually would do for a heart rate problem, usually a tachycardic rhythm, to slow a heart rate down if it was tachycardic, not for a hypotension. But you guys did pretty good. That last one, I ended it with a little bit tricky, but you guys did great. Thank you guys so much for tuning in. I hope you guys learned something new. If not, we go live 7 times a week during 5 different days of the week, so you can tune in at whenever during those times. We go live on Tuesdays at noon Central Time, Wednesdays at 11 a.m. and 7 p.m. Central Time, Thursdays at 11 a.m. and 3 p.m. Central Time, and Friday and Sunday we go live at 7 p.m. Central Time. So multiple times for you guys to get plugged in, get some extra NCLEX practice, and I will see you guys next week. Bye, guys.